Hi there, Dr. John and Dr. Mateo here, and we just wanted to send you a quick little video message. The reason you're getting this video is you are due for a reevaluation coming up here soon in just a couple of days. And we just wanted to take a few moments to reiterate the importance of when we do the scan, why that's so important. Many of our patients came in here on a reactive basis, meaning they had some sort of pain or ailment that they were coming in for resolution for. And if you think back to the very beginning when either Dr. John or myself first spoke with you, we reinforced the importance of it's not just how you feel, it's how you are, it's how your body's functioning. We start to have problems when the body starts to dysfunction. And so part of the initial evaluation we did was a computerized scan to assess the health of your nervous system, and it allowed us to see any functional disturbances there. And part of the goal of your care was not just to make you feel better, was to make your body function better. There's things in this world that can make you feel better. You can take drugs. For some people, alcohol makes them feel better, but that doesn't make you any healthier. So the goal of the scan there is once we see where we need areas of improvement, then the follow-up scan, we want to see, well, how are we doing? How are we coming along with that? And so as we get closer to do this scan, the scan's going to give us a lot of information as to how far along in the healing process are you, not just from the absence of your pain and symptoms, because many of you, I'm sure, are feeling better already. And the thing to think about it, and I always like to use the example of a broken arm. If I were to break my arm and my arm's swollen and black and blue and it hurts like crazy, and I go to the emergency room and I get it set and casted, well, within a day or two the pain's going to go away. Is my arm healed? Well, the obvious answer is no. The healing's going to take place over the next 4 to 6 weeks. And so that's what we want to make sure when patient's pain goes away, have we restored normal function to the body.
So when you do come in for your scan, there's three possibilities of what will happen and what we can expect to see in the scan. Number one would be the best possibility, and that's where your scan looks great, everything's returned to 100% normal function, and at that point we will make our wellness care recommendations for you. The other thing that could happen is that there's no change at all, and very few patients experience this, but that could happen. And again, the reason that we do an objective test like this is so that we can determine whether or not your body's returned to 100% normal function. So if it hasn't, and if there has been no change, then we will alter the treatment recommendations or continue adjusting you until we do bring about that 100% normal function to your nervous system. The third possibility is that it gets worse. And again, this is just an indication that your body has still not reached the plateau or the area that it needs to maintain its 100% function. So again, we will continue to adjust you until we see that 100% resolution on your scan. So we look forward to seeing you in the next couple of days. On that day, make sure that you don't drink coffee or take any stimulants. If you take medication, make sure that you do it on your normal schedule. And a workout that day would not be a good idea right before your scan, because we want your system as relaxed as possible. So we look forward to seeing you and hope that your scan turns out good. Bye-bye.